Tetanus is a disease caused by a bacterium which produces a neurotoxin responsible for the clinical features. These bacteria live predominantly in the soil, it is easy to get this infection whenever a break in the skin is not cleaned properly. Tetanus-prone wounds include burns, puncture injuries, or those contaminated by soil or manure, septic wounds, and even those with much devitalized tissue and compound fractures. The use of non-sterilized instruments or dressings on the umbilical cord predisposes to neonatal tetanus, and the incubation period is 3 to 21 days. Tetanus should be treated as a medical emergency, and tetanus immunization is the key for prevention. The main cause is Clostridium tetani, that's a bacteria, and the symptoms are constipation, difficulty or inability to open mouth, stiff body, spasms that are painful and are triggered by noise, bright light or touch, and also spontaneous in severe cases, as these spasms are spontaneous in severe cases. Signs that are usually elicited include irritability, presence of wound but may have healed, the umbilicus may be infected, and also cyanosis during spasms, and sardonic or mocking smile, lockjaw as cannot open the mouth, and opisthotonus as stiff arched back, and there's also rigid abdomen and stiff neck and limbs. Investigations: no confirmatory test is required. Diagnosis is usually clinical, and the main treatment objectives are to prevent further spasms, to eliminate Clostridium tetani, to stop further toxin production, also to neutralize circulating toxin, and to provide adequate hydration and nutrition, also to provide supportive care till spasms cease completely. For non-pharmacological treatment, always admit a suspected case of tetanus and maintain a clear airway. Avoid noise, bright lights, and unnecessary physical examination of the patient. Clean the infected umbilicus or wound with soap and water or antiseptic solution. Surgical debridement of the wound when necessary. So, pharmacological treatment: eradication of bacteria in a patient diagnosed to have tetanus. First line treatment: you give metronidazole IV in adults, 500 milligrams 6 hourly for 7 to 10 days, and for children more than 1 month, give 7.5 milligrams per kilogram 8 hourly for 7 to 10 days, and for neonates more than 7 days, you give 7.5 milligrams per kilogram 12 hourly, and less than 7 days, you give 7.5 milligrams per kilogram 48 hourly. Second line treatment: you give a benzyl penicillin IV. Adults, you give 50,000 units per kilogram stat, then 4 mu 6 hourly for 5 days. For children, 50,000 units per kilogram 6 hourly for 5 days, and for neonates, 250,000 units 6 hourly for 7 days. And then you add gentamicin IV, neonates only, 4 milligrams per kilogram 12 hourly. So to neutralize free circulating toxin, you give human tetanus immunoglobulin, IM or IV. For adults and children, you give 500 units stat. For neonates, 250 units stat, and tetanus toxoid IM, you add that one to it too. So inject at different sites from the human tetanus immunoglobulin for adults and children. Specifically, children 2 years and above, use 0.5 ml stats and repeat at 4 to 8 weeks as a second dose, and then at 6 to 12 months you give the third dose. And less than 2 years, you give 3 doses of pentavalent vaccine at intervals of 4 weeks. To control spasms, you give chlorpromazine IM 50 milligrams 4 to 8 hourly, and then you add diazepam IV or IM by slow IV at a rate of not more than 5 milligrams per minute. So this you give 5 to 10 milligrams 3 to 6 hourly when required, or you can give phenobarbital IM 200 milligrams 8 to 12 hourly, and gradually reduce sedation after about 2 weeks. Children, give chlorpromazine IM or oral via nasogastric tube, and give 12.5 to 25 milligrams 8 hourly, and then you add diazepam IV or IM or nasogastric tube or suppository 0.3 milligram per kilogram 3 to 6 hourly when required, by slow IV at a rate of not more than 5 milligrams per minute. Or you can give phenobarbital IM or oral via nasogastric tube 10 milligrams per kilogram start, and then 2.5 milligrams per kilogram 12 hourly. And for neonates, you give chlorpromazine IM or oral via nasogastric tube 7.5 milligrams 8 hourly, and then phenobarbital or phenobarbital IM or oral via nasogastric tube 30 milligrams start, and then 7.5 milligrams 12 hourly. Neonates, if spasms are not controlled with the above therapy, you add diazepam, rectal diazepam 0.5 milligrams per kilogram 3 to 6 hourly when required. For tetanus immunization, start immunization before discharge from the hospital in all patients, because tetanus infection does not provide immunity against future episodes. And an adult who has received a total of 5 doses of tetanus toxoid is likely to have lifelong immunity. A course of tetanus toxoid vaccination should be given to any previously unimmunized patient older than 2 years of age, and dose 0.5 ml IM or deep subcutaneous SC. Repeat at 4 weeks and 8 weeks as a primary course. And if 10 or more years, 5 or more years for children below the age 15 have elapsed since primary course of last booster, you give booster dose of 0.5 ml. And in tetanus prone wounds, start the primary course in the non-immunized patients. A booster dose may be given if more than 5 years have elapsed since the last dose. Survivors of neonatal tetanus should follow the normal schedule for 5-in-1, that's a pentavaccine. And previously unimmunized children below the age of 2 years should receive 3 doses of the 5-in-1 at intervals of 4 weeks. Cut umbilical cord with sterile instruments, clean with methylated spirits as alcohol, and leave uncovered. And to prevent tetanus in patients with potentially contaminated wounds, that's tetanus prone wound, provide adequate wound toileting, and also provide tetanus prophylaxis. Okay. Tetanus immunization in pregnancy is also vital. So referral criteria: refer patients to a specialist if spasms cannot be controlled.